everybody. It's Michelle, host of First Bite, Fed, Fun, Functional, the podcast, in honor of Pediatric Feeding Disorder and ARFID Awareness Month, and in celebration of First Bite hitting a 2 million download on May 18th. My co-host Aaron Ford and I are hosting for free a 0.6 ASHA CEU conference titled PFD in Schools, Lessons from the Trailblazers. We will be joined by 8 other industry leaders, including Jacqueline Peterson, Amy Delaney, Jennifer Egert, Dawn Mirth Johnson, Carolyn Dolby, Emma Lou Justice, oh my God, Emma Justice, Sasha Watson, and Anais Villanova. As a bonus, Speech Therapy PD is donating $1 for every person that signs up to Feeding Matters. So please visit speechtherapypd.com/PFD to sign up.
Welcome back to School of Speech. This week, we're going to rewind to episode 9, Embracing Verbal Diversity, Navigating Stuttering Service Delivery in the Schools. So if you missed it the first time, or you just need a reminder of its impact, join me, Carolyn Dolby, and the brilliant Nina Reeves as she unpacks what it really means to support students who stutter. This episode is packed with aha moments that will have you nodding, rethinking, and maybe even shouting out, yes! Whether you're new to stuttering therapy or you've been at it for years, this episode will change your thinking and inspire you to show up differently for your students and for yourself. Added bonus, each episode of School of Speech is offered for 0.1 ASHA CEUs. So go ahead and hit play, and let's embrace verbal diversity like the rockstar SLPs we are.
Hello. Welcome, everyone, and thanks for joining us today. Today's episode, I'm so excited, is Embracing Verbal Diversity, Navigating Stuttering Service Delivery in the Schools. In this episode, we're going to dive into the complexities of stuttering interventions and best practices. We'll explore strategies, sensitive assessment techniques, innovative therapy approaches, and uncover valuable insights to foster understanding and empowerment. But before we get started, we do have some housekeeping. Each of these episodes will be 60 minutes and will be offered for 0.1 ASHA CEUs. I'm going to just jump into some of our disclosures. Our guest today is Nina Reeves. We are so excited to have you. Hello. Nina receives royalties and has ownership interest with Stuttering Therapy Resources, Inc. And then non-disclosure, she is a volunteer and consults and on advisory boards for the National Stuttering Association. For me, I am salaried for my work as the District Dysphagia Support SLP in the public school system. I'm compensated for my graduate courses I teach at the University of Houston, and I'm a consultant for school districts across the nation, supporting their program development and staff training. I'm also receiving compensation from speechtherapypd.com for hosting this podcast. Non-financial, I'm a member of TISHA and the Feeding and Swallowing Task Force. I volunteer also for Feeding Matters, and I'm a member of ASHA Special Interest Group 13, Swallowing and Swallowing Disorders, as well as SIG 16 school-based issues. I did forget to mention one of the disclosures for Nina. Sorry, she is receiving an honorarium from speechtherapypd.com for today. On that, I really want to welcome Nina. Nina, she's on staff as their fluency specialist for Frisco ISD and fluency specialist consultant for San Diego Unified Schools. Nina is a nationally recognized workshop presenter in the area of fluency disorders and the author of clinical-based materials. She is co-author of Stuttering Therapy Resources. She is also a recipient of numerous awards, including the ASHA Fellowship Van Haddam Award for outstanding contributions to public schools. And she was recently awarded the ASHA Certificate of Recognition for special contributions in preschool through grade 12 education settings. Nina, we are so blessed to have you. Thank you so much for coming today.
Well, thank you.
Oh.
And I'm so glad to be here. And I realized that in my intro, I still had we talked about this a while back. I still had that I was a part of Frisco ISD and
Mhm.
San Diego Unified, but this was my first year without a public school in the 30 plus years of my career. This was my first year without a public school setting placement. So it's been an interesting year for me to find my new identity in the world because it's always been and probably always will be a school-based SLP. So I'm really excited to be here. Mostly, there are a lot of people I can already see in the chat that there are people that are not in the public schools. So you'll still learn things today. I may slant my comments for public school SLPs because I just am one, and that's the way I think. But know that treating stuttering effectively as a verbal diversity is not area specific. So it's going to be a fun time today, and I'm glad to be here.
When I was a campus-based clinician, I had very few on my caseload. So I know that this is a hot topic, and we want to learn so much from you. You said something, verbal diversity. I would love for us to start there. Could we start with let's define that for us.
Yes, it's a concept that I talked about years and years ago, and it seemed to catch on and seemed to sort of light a fire for people to wrap their brains around the fact that stuttering is simply another way of talking. It's a variation in human expression, and it can be accepted and celebrated and doesn't need to be air quoted fixed. So it's a concept that really supports that paradigm shift, not only in our profession, but in society. I feel like it encapsulates the philosophy that Scott and I carry in our stuttering therapy resources work. But I'm really excited about how verbal diversity continues to evolve and
Mm.
become part of our zeitgeist. I also find it most powerful when I allow it to be defined by the individual who stutters. We start to talk about what verbal diversity would mean for that student. And I think I can define it the way I coined it, but I think it's important that the individual student discusses and finds a way to think about what life as verbal diversity. If everyone could see stuttering as simply what it is, another way to talk, and move away from that focus on fluency, moving away from praising fluency as the gold standard of communication, and realizing that there is no such thing as a fluent speaker. There are disfluent speakers, and there are people who stutter, and that crosses over sometimes. But the idea that there is perfect fluency is a fallacy. And I think that verbal diversity is part of a broader conversation in a world that continues its journey to embrace and understand neurodiversity in general.
Wow, I love that. I really loved when you think of verbal diversity being just another way of speaking. That's so powerful to hear that it's not wrong,
Yes,
right?
so
It's
important.
not it's not wrong. It's just another way of speaking. And of course I like to hear, there's no 100% and perfect fluency is never a goal. I think we all love hearing that. Absolutely.
Well, we've been writing those goals for so long and never really achieving them, or achieving them on one day and not on another, because the basis of stuttering is that it's variable. So
Mm.
trying to write a fluency goal is like what I call chasing a greased pig. It's just always going to slip out of your hands because of the nature of stuttering. But I do want to be clear about something, because when I started talking about verbal diversity years and years ago, it kind of broke the internet, and people were like, I don't wait, I love it, but I don't really understand now. What do I do as a SLP? And I want to make sure that that verbal diversity is a part of a broader conversation, and we have to be clear that it doesn't change eligibility.
Mm.
It does not change eligibility, and it doesn't change the need for therapeutic support. Yes, it is okay to stutter, And yes, people who stutter naturally stutter sometimes, but that doesn't mean we go, hey, go out there and stutter and everything's great, because the children with whom we work do not have that sense about them yet, that they need therapeutic support to plant those seeds over time and continue that conversation about you are okay exactly the way you are.
I love that. I love that. Why don't we get started maybe with eligibility? Do you want to start getting into, let's start from the beginning. We've defined verbal diversity. Let's start from the beginning. We're going to do an assessment.
Yes, we are going to do an assessment. And then right at the end of assessment, don't let me forget to say something about the eligibility component.
Okay.
Because it gets very confusing, and I love to quote IDEA and chapter and verse about what it really does mean, and why administrators especially get real confused about what that means for kids who stutter. So don't let me
I
forget.
will.
But I
I'm
want to
on.
dive in. Anyone who has ever heard me speak will know that I'm going to talk about the ICF, the International Classification of Functioning, Disability, and Health from the World Health Organization. And you're going to hear me talk about it, number one, because it's literally planted in the middle of our scope of practice document. So if you haven't seen the ICF model, you haven't seen your scope of practice document in a while. Make certain that you understand ICF in general. And I'm going to talk today about how it relates to assessment and goal writing and report writing and therapy and documentation, because it's a framework instead of a program. I don't believe in programs. They're not individualized. You don't start every kid who stutters with one thing. That's just not legal or advisable or ethical. So I think the ICF is a great framework for us all to work from and problem solve for those individual kiddos. Gone are those days. The ICF helps us know that we're no longer just counting stutters and then determining what we want to do with a kid. I want everyone listening to know that in the show notes, you're going to have the references to the ICF and how it relates to stuttering. But for a brief review here, I'm going to say that it gives us a glimpse into the entirety of the speaker's experience of stuttering. And I'm going to really focus on that and talk about how our profession has been way too focused on the listener's experience of the speaker's stuttering. I know, boom.
I know that was, I'm
blows our
sorry. Yeah.
mind.
I was like, that hit me right there, that it is the experience of the speaker, not the listener. Oh, Nina,
I
keep
know
going.
it changes everything.
It
It's a game
does.
changer. And so in the ICF model, we understand that the origins of stuttering have been misunderstood for centuries. And I mean centuries. And understanding that stuttering, we know that stuttering has a genetic component for some of our students who stutter, may have it running in their family, others will not. But we know that it's neurologically based for all. Stuttering is a neurologically based speech difference. And that in and of itself helps us debunk some of the myths about it's an anxiety disorder and they're just talking too fast. There are so many myths about it that can be cleared up with the fact that it's neurologically based. And so when we take the components of the ICF model, we look at the impairments in body function and structure, number one, but we have to think about the fact that that's the speaker's internal sensation of feeling stuck or losing control of speech. It's not what you see on the surface. It's that internal, because we're not going to see every stutter, but the kids will feel them. It's a feeling of stuckness, even if they can't tell us about it and explain it to us. That's the internalized feeling. That's what research tells us. So here's the reason why, when we're talking about function, people think, oh, I have to count stutters. Well, in my own world, I count stutters every 3 years in public school institutional settings because I'm forced to. I don't
Okay.
count a stutter at all any other time. And in private practice, I don't count stutters at all. Now, hopefully it'll change in the school setting someday because again, that's measuring the listener's experience of the speaker stuttering. And since it's variable, counting stutters actually has very little meaning. But we do what we can and we do what we're, told to do. But we also understand that when we're assessing a count of stutters, we're not really getting at what we're trying to assess is how the student experiences those feelings of stuckness.
I like that, feelings of stuckness. What were
Yeah.
those three? I know one was function. What were the other two in the first part of the body that you said in the ICF?
In the ICF,
Yeah.
we're the impairments in body function and structure. That's number
Okay, that's
one.
what it was. Okay,
Now
number
I'm
one.
going to get into personal factors. Okay, that component of the ICF includes the affective, how your student thinks and feels, actually how your student feels, cognitive reactions, and personal factors are those thoughts about themselves and about communication and whether their identity, how they feel about being a person who stutters. And then the behaviors, which is the overt and covert tension and struggle and any avoidances. So we're going to use an assessment to find out the thoughts and feelings. There are many out there, but I want to remind everybody that you don't have to have a standardized assessment. It can be interview, it can be portfolio documentation, it can be checklists. Of course, there are, the behavioral assessment battery, other things out there, the A19 scale that are helping us assess thoughts and feelings, but we don't want to not look into this. This is a very big part of the ICF model and a part of our assessment. The third factor is the environmental factors, and that includes the child's world. It is really the reactions and attitudes of listeners and others in their life. What do they perceive stuttering to be? On one side, and on the other side, it's the influence of that speaking situation that a student would encounter in everyday life. The difference between talking to your pal at the lunch table and speaking in class. Those are the environmental factors, and we have to assess and understand where the child is with some of those things. And the final one is the one really that hits home in public schools, but for everyone, it's the activity limitation and participation restrictions category. And that leads us to look at any areas where the student is holding back from communication, including in education or work or social aspects of life. And I use the OASIS, the overall assessment of the speaker's experience of stuttering, to get a lot of that information. That's a game-changing assessment as well. It's the impact of the stuttering on the quality of the child's life. And so
And that Oasis that you like? Yeah. I just want to make sure I heard Oasis. Yeah.
Yeah, there's a lot of assessments that I use, and OASIS is part of finding out that beliefs, that feelings, that impact. How does that student, and that's for 7 years old and up right now, although there's probably going to be one for younger at some point. But I just want to say that one of the things when I got into this profession is that we did fluency counts, and we did a case history, and that was kind of it. And we want to make sure that that is not what continues to go on, because those aren't the salient details of how stuttering impacts a student's life.
Okay. So just to reiterate, really following that ICF model, and it will be in the show notes with the reference on getting all of that information, is really the meat and potatoes, if you will, of your assessment, right?
It is. It's the meat
Okay.
and potatoes of of assessment, goal writing, report writing, documentation, intervention. It's the framework that helps me know, am I too much on one part of this? Do I know where this child is on these other aspects? Are we too focused on one part of this and to the detriment of the rest of it? Because really, the ICF and your participants are going to see it in the article that I've referenced. The model itself, the visual, has all sorts of lines going back and forth to each other because function, reaction, environment, and impact really affect each other. So it's not just we're doing something in one area. We're really doing something that can actually reach out to the other categories of the ICF and the experience of that student stuttering.
And what would you, for somebody just, I saw somebody who's just brand new, just starting out as an SLP. We have a brand new SLP listening tonight. What are some resources to help with doing her first stuttering assessment?
Oh, that always puts me in an odd situation because we have a book. And it's not like I come
well,
onto
no,
these things.
tell us about the book.
Okay.
No, tell us.
Scott
We
and I,
want to know. Yeah.
Scott and I live and breathe to help SLPs help people who stutter. That's our mission statement. And we have the comprehensive guidebooks for both early childhood and school age stuttering that walk you through the ICF as far as it, means for assessment and goal writing. We really take you through exactly what I'm talking about, but in, 300 pages instead of in an hour. And it's really important to have sort of that overview because I have watched my colleague friends try to grab things off of, internet accessible platforms. I won't name anything, but there's platforms out there and everybody's just looking for a worksheet. And I'm saying, wait a second,
Right.
how does that fit into the overall framework of what this child is experiencing in real life? So I want to make certain if we start with the ICF model, it really does hone in our ability to not need a program anymore and to not go flailing looking for some cute font somewhere. We're going to find the things that matter to this child's communication environment. And we're going to do much better therapy and we're going to feel more comfortable and confident.
I'm not sure if we said it or we said it before the podcast when we were chatting about how important it is for the stutterer I think you did, to be the one to explain what stuttering means to them.
Yes.
And I think it kind of everything you're saying it's just 100% student focused, 100%. I love it.
So, I think what we're trying to say is I kind of folded the ICF into assessment because that was our first topic, but I want everyone to understand that framework is going to help with all aspects of what you're going to need to do in preparing therapy for a kiddo who stutters.
Well, I think that's a great lead in to now you've done your assessment, but I want to ask a little bit. You asked me to ask you about eligibility. I think this would be a good time.
Yes. Okay. Before we get to any next topics, let's stop and say eligibility in the public school setting is different than eligibility elsewhere. But under our guidelines, IDEA reauth of 2004, and I still can't believe it hasn't been reauthorized since 2004, but that's what we've got. And it gives us so much good because gone are the idea that the child has to be failing in class or not doing well academically because of their stutter. Because IDEA says anything that gives a negative impact to academic non-academic or extracurricular areas. Now let's reframe that.
Mhm.
Academic, social, and functional communication. It's all of it. So if there's any adverse impact in any of those areas, the child is eligible for stuttering therapy in the public schools.
There you go. Boom.
Don't let anybody tell you they have to have a percent of stuttered speech. That is false, false, false. That that's gone, except in like 2 states, and we're still trying to help those 2 states come into this millennia. Those things are just not appropriate any longer, but some administrators get confused by it. So I want us to stand in our IDEA understanding that there is a broad way to assess, and that gives us a broad level of eligibility for kids who stutter.
That's fantastic, right? We're empowering those SLPs
Yes.
to really advocate for the student and the student needs, not just, okay, they're failing in an academic. That's fantastic. I mean,
They don't
everything.
stutter enough. I had an administrator tell me that they don't stutter enough. I'm like, I can do eligibility for a kid I've never seen stutter. Watch me, right? If I'm collecting enough of the thoughts and feelings, participation limitations, right? The environmental factors. If I'm looking at all of those areas, I don't even have to see an outward stutter. If somebody says to me, this child goes, I, I want to go. Nobody makes that up.
Mhm.
Okay. So I'm not saying that I've done that a lot. I'm just saying to set that whole idea that they don't stutter enough on its ear. Let's talk about the fact that it doesn't have to be the listener's experience of the speaker stuttering in any way, shape, or form.
Absolutely. It's the experience of the speaker themselves.
Yep.
And I think you're hitting it with the impact that it
Yes.
has on the students holistically. That is fantastic. All right. So we've got into assessment and definitely eligibility. How about developing goals? Because
Oh, wow.
right.
This is where I wish for like 40 more minutes, but
Oh.
we're gonna do an overview
Okay.
of the goals, because what I want to say about goal writing, number one, is that I get this is our one of our most frequently asked questions from our colleagues is, could we have a goal bank? Could you just tell us how to write the goals? And our answer is no, not because we're mean, not because we can't do it, but because putting words on a piece of paper does not mean you're going to do good therapy. If you don't understand what you're writing, a well-formed goal means nothing. And I know that's sassy, but it's true. So if we can get away from trying to write the perfect goal, but to write an appropriate, individualized goal. And the good news is that comprehensive assessment that we just had a brief overview of can lead us to writing individualized, appropriate goals to plan effective and efficient therapy. And I just want to keep us in that thought. We're moving away from fluency focused goals towards more stutter affirming goals. And in that way, the goals that have been written in the past that are based on this arbitrary measure of fluency, I really talk about it that they're a due process waiting to happen. Because any savvy parent or advocate who understands stuttering at its core, that it's constantly going to be variable. It's inconsistent across time, across situations. It is a day-to-day different. And so it's an arbitrary measure of fluency. And a child can attain that by not talking. A child can attain fluency by not saying all the words they want to say, by changing a word, or by not raising their hand, except for a 2-word answer. These are not measures of fluency that we want to condone. We want to talk about goals that represent the skills we're working on in therapy, So if we're working on acceptance and desensitization and understanding of stuttering and speech, we're going to, even a strategy, an actual communication skill like a pull out or a cancellation or a voluntary stutter, we're going to write goals about those skills and whether the child was able to demonstrate their knowledge and understanding and use of whatever we're working on in therapy. We're just not going to write it as a moniker of fluent speech. Does that make sense?
Yeah, we had a question just to kind of wrap our heads around, and maybe I know we don't want a goal, a pooling of goals or anything, but just
Yeah.
like an example of a goal using that ICF model. Jennifer was asking, is there, based on your assessment using the ICF, what could be a possible goal?
Okay. So let's think about function, reaction, environment, and impact. You
Mhm.
know, in the area, let's just give, because I'm watching our time. I'd love to give, 15 of all of these, but just the concepts under environmental factors. Is the child educating others, self-advocating for themselves? Is the child working along a hierarchy of desensitization, which is the thoughts and feelings, the personal factors part of the ICF, to overcome any feared speaking situations? And now we're talking thoughts and feelings and environment. And
Mhm.
so those kinds of things are important. Is the child participating? So activity limitation, participation restriction. Are they raising their hand when they weren't before? Are they no longer just holding the poster in a group project and letting everybody else talk? Are they participating in classroom discussions at whatever level they can right now? And are we working to make sure that they're always accessing that curriculum and not trying to pull themselves back from talking, let's say in class, or going out for the debate team that they really want to go out for, but they think they can't because they stutter? So it is wide rangingly different than writing goals for fluent speech. It's huge. But you're going to see some stuff in our book. You're going to see some stuff in the article that I referenced to you. And there's a reference to an article from Language, Speech, and Hearing Services in the Schools from
Mhm.
January of 2023. It was a whole journal about anti-ableist practices in the public schools for autism and stuttering. I would read the journal from cover to cover if I were you. And it really kind of walks you through some of this. And one of the articles I was co-author with two wonderful colleagues, we did case studies of students in the public schools, what the old way was happening and how we would change it to the new way. And I think some of those will answer the questions people might have.
That's fantastic, because we did have somebody ask when talking to parents the difference between neurological and developmental stuttering, and they were saying, am I using language and concepts that are outdated? And so I think going back,
I think they answered
I
their own
think
question.
I think so too.
And
Yeah.
that's so wonderful. The way they phrased it, they already kind of knew. Yeah, the stuttering is stuttering, you know, early, mid, late, doesn't matter. Now there's neurogenic stuttering, which is traumatic brain injury, stroke, those kinds of things. That happens because of an insult to the brain. Yeah. But neurological just means, as a part of this child's neurology, there's a glitch from the strings, the signals in the brain to the speech muscles. Now that's simplistic, but there is something happening in the body structure and function that's simply different, not defective,
Mm.
but different than the way our speech parts of our brain and body work when we don't stutter.
That is right. I mean, neurodiversity affirming, verbal diversity affirming. I think
Yes.
those are the terms that we're going to start needing to say and using those terms when we're talking with families and our admin and the teachers. I think that's important when we start reframing how we speak about it.
You got
Um,
it.
it's going to make the change. And it really is advocating for the student themselves, specifically for them. We're not trying to change them to make them a non-stutterer.
Yes.
That's not, yeah, right. Okay. I love it.
That's what ableism is. It's
Hmm.
preferring a certain body and function over others. And so we wouldn't try to make a child non-autistic. And so we're not going to try to make children non-stutterers. I don't know. There's a stigma though that still lies in that arena, and people are still going to expect us to fix this. So we have to know that as we talk about the facts about stuttering, that, and explain maybe to everybody in the room why there's no more fluency goals, we have to really stand in our knowledge, our evidence-based practice, that stuttering is a scientific thing, and it's not something that you can wave a magic wand and fix, or just talk slow and it's going to go away. This is neurological. So when we talk about it in this way, it's going to help us frame those goals according to the ICF: function, reactions, environment, and impact. Whatever you found out in your assessment, you will then write goals in those areas. And we have a handout on our website for free that just sort of talks about, formulating goals, not giving you goals, but formulating them. And then we wrote an entire basic chapter in our books about this as well. But I want to get us back to the idea that we're writing those goals, representing the skills we're working on in therapy, and that we're moving away from that stringent adherence to documenting progress. You don't have to have a percentage for everything. That may be what your administrator says, but it's not true. IDEA gives us the power to use portfolio-based documentation, rubrics, parent reports, teacher observations, student self-reporting in their stutter notebook about how many times they raise their hand. These are all appropriate ways to document progress in a different way, in a way away from a percentage of fluent speech.
I think I think I know the answer to this, but I'm going to say you may have a goal in each of the function, reaction, environment, and impact. You might have one in each of those four, but only if they need one in each of the four. You wouldn't have to come up with four goals, right? You wouldn't be like, every
Oh,
kid now has four
absolutely not.
goals.
Yeah,
I just, okay. I
absolutely.
just thought
No,
yeah.
I'm so glad you clarified that for people, because this is fast. This is a lot, all in an hour. And I understand that it's hard to, especially if you're coming from the medical model of we've got to fix this pathology, and
Right.
moving towards the idea that it's normal and natural for people who stutter to stutter, even though nobody
Mhm.
wants to say that. It's really true. Nobody wants to hear it. Nobody wants to say it, but it's truth. It's evidence-based practice. And I love that you brought that up, because of course we wouldn't have to write a goal in every area. Your assessment is going to drive your goals.
Mm-hmm.
You could have 4 in one area and
Gotcha.
1 or none in another. I just
Mm-hmm.
want to make sure that we're looking at all those areas. And I think I should say something about the function part.
Mm-hmm.
People are like, well, if I'm not going to write a fluency goal, like, what about the strategies? Am I still
Right.
going to work on strategies? We are not throwing everything that we know about stuttering therapy out. We're going to move away from spending so much time on fluency strategies towards spending time on developing rapport. We're going to develop knowledge on how stuttering impacts the student's daily life and communication, and we're going to write goals towards that. But if you're going to write a strategy goal, let's say voluntary stuttering, it's going to be: the child demonstrates the ability to utilize voluntary stuttering this many times out of this many times in this situation over this many reporting periods of this many weeks, as documented by blah, 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 blah. Okay. Let's say clinician data keeping. or student self-report. So it's going to be the same way that you write goals, that you formulate a goal, but it's going to be about the skill, not about the fluency.
Mm-hmm.
So function, reaction, environment, and impact. I think I gave kind of an idea for most of those.
Yeah, wonderful.
Okay.
And I just threw it in the chat, just those 4 areas so we can remember, because
Yeah.
I feel like those
And
4
you'll see this in the article. It's
Okay.
coming to you. I just held up the ICF model as it relates to stuttering. It's right there in the article. It's going to blow your mind. It's going to make your day.
So I think this kind of leads into, and there've been some questions about paint us a word picture, if you will, of what a therapy session would look like.
Oh
I know
my
that's a
gosh.
huge question. I know yeah, that's huge.
Yes. Yeah. This is where my love-hate relationship with 1 hour courses comes.
Mhm.
Because I know that the participants and listeners really want and expect me to provide them a list of what to do in therapy. But they already know, we all know that taking 10 to 15 minutes talking about intervention is not going to bring a usable list. It's just going to be a mismatch of things that need more explanation. But I do like that the time constraints force me to distill some major points and find those most important changes that I see in my career that can create stutter forward environments in your therapy sessions and beyond. Because, neurodiversity affirming practices require us to rethink what we're spending our time on during therapy sessions. And
Mhm.
even though I said we're not throwing out everything we've done, we are changing the distribution and intent of the therapy concepts. So that's our science of therapy, is we're going to take those concepts that are all valid and we're going to adapt them and change them away from, we're going to do all of this so you don't stutter anymore or so that you stutter less.
Mhm.
And we're going to change it to, we are going to learn about communication so that you can communicate in an easier way. And as I like to put it, how are you going to navigate stuttering in a world that doesn't get it? And be
Right.
okay with yourself. And
Mhm.
that's the point of what we do in therapy. So the art of therapy then becomes if, when, how we present certain concept based on the child's age and awareness and readiness. We would think about these things in any therapy that we do. We would adjust and we would problem solve. And sometimes when the word stuttering comes, everybody goes, oh my gosh, I don't know, I don't know. But everything you know about communication, everything you know about interacting with people in nonverbal and verbal ways comes home to roost in stuttering therapy. Bring it with you. And then we'll do some other things that can really make a change for the kids. So I'm going to go through 4 things that I think are the biggest changes. Now I could go through
Okay.
800, but I'm going to try to distill. All right. The first thing I would say is start strong. Sometimes in my career, I have watched referral, assessment, easy starts. Like everybody jumps right into the tools, right? And they're all fluency
Mhm.
tools instead of stuttering, working on communication in general. And so we're going to stop focusing on those fluency and fluency enhancing strategies and redirect our beginning therapy to focus on learning about talking and stuttering, learning about the community, learning how the community of people who stutter, learning to self advocate and educate others. We're going to help kids understand and identify their moments of stickiness. And we're going to talk about them. We are matter of factly just learning about how this feels in their mouth and in their speech system. We're going to help kids develop healthy attitudes towards stuttering and communication. So we're going to start in ways that aren't all about, let's get at the stutter itself, the moment that we can see. We're we're going to weave in the idea that this kiddo can't do anything with their speech difference if they don't understand what's going on. Okay. The second one, I really love this idea. I called it, I did a post on our Instagram about be a stutter detective. And that is being the SLP that takes a kid that just came to you in therapy. I don't care how long they've been in therapy. Don't believe the paperwork. Find out. Be the detective. What did this child learn? What did they not learn? What if they never heard before? What did they learn but don't remember? And what can they recite to you but don't know how to use in real life? I have kids who can tell me all the strategies, but wouldn't be able to show it, or even if they could show it to me, wouldn't be able to use it in the real life realm. So you're going to find out, where are those gaps? That's what a stutter detective finds out. It can be a kid you've been working with, and you can go back and say, we're going to find out if there's any gaps that we've got to go back and fill. Because, we learned this when you were a second grader, and now you're a fourth grader. And maybe there's some more mature ideas that we could weave in for you. So when in therapy, we become a stutter detective, we can fill the gaps that then create a support for more effective therapy down the line.
I love it. Stutter detective.
Stutter detective. Start strong and be a stutter detective.
Start strong, stutter detective. How about starting strong with just a itty bitty one, like brand new to therapy and a young, like a pre-K?
Okay. So I've been talking mostly about school age stuttering. An itty bitty early childhood. That's why we had to write an entire other book that was supposed to be half the size of our school age book and ended up being bigger. Because these are they're just fresh, and we want to make sure that we're doing therapy differently with early childhood than we are with school age. Okay. So yeah, we might talk about the speech man and the speech machine and all of those things, and talk about talking, but we don't know, there's more direct and there's less direct therapy focus, and we wrote the whole book on it.
Maybe we'll have to have another episode on just strictly the little guys.
The childhood. Love it. Love that idea.
Okay. Writing it down.
All right. Now, but you can still be a stutter detective with them, and you can also do some of these other things I'm going to talk about, especially supporting everyone's connection. The third one, that strategies are not the end all and be all. The biggest change that is going to happen in our world of stutter affirming therapy is, if we're not so focused on fluency, then we're not going to be spending our entire session doing, let's do our easy onset. Okay. Doesn't mean we'll never do an easy onset. It's just that we're not going to spend as much time on any of the strategies. They're going to be part. Notice in the ICF, it's part of the overall. It's the, it's the moment of stuttering. It's the feeling of stuckness. It's dealing with that. But that's only a little bit of what we're supposed to be addressing in therapy. And I want to say this. I feel like when people ask me about what am I going to do in therapy, I want to mostly start with what we're not going to do.
Okay.
We're not going to focus so much on strategies, but we're also going to, strategies still have a role for some kids, to move through a stutter easier, to feel that they can start out easy. That's okay. All right. As long as we're not doing it to not stutter, as long as we're doing it for the ease of communication. But I also understand that in our profession right now, we are not getting the training we need in our graduate programs. Not all the graduate programs are putting enough time into this. And so we have to find out what the strategies are and are not. Because I've gone into therapy sessions and asked the child what their strategies are, and they say, I know all my strategies. I know deep breaths, slow down, and continuous phonation. None of those are strategies. 0 out of 3. And that's scary to people that have been doing them forever and ever. So you have to go back and find out new informed information, evidence-based practice of what the strategies are, because for too long it's been only fluency, poor Van Riper, and cancellations, pullouts, voluntary stutter, preparatory sets. Those have all been by the wayside, and they've got to come back. If we're going to do strategies at all, they've got to be a mixture based on what the child needs. And I want to have us, so update our information, and then please don't look on internet available platforms for what the strategies are. Because
Okay.
I've seen them come across my desk as the 14 strategies, the 22 strategies, the mushy mouth, the feather speech. These are not strategies. These are not skills we're going to teach, because they're just cutesy, but really they're 5 things that are really an easy onset, or 5 things that are really a pullout. And the kid is trying to remember 22 things, and it's really disparaging for those kiddos. So find out the strategies are and are not, and then make sure that you know how to guide them. We actually have videos of how we would guide a kiddo through all of the strategies that we pull into our therapy on stutteringtherapyresources.com on our YouTube. Okay. We're going to really learn how to coach kiddos through those things. Go ahead.
Oh, sorry. I was just saying, I've watched your videos. I love them. I support, I want to encourage everyone to go and take a look. They are so amazing, Nina. Amazing. But yeah, I want us to keep going. I'm sorry, I didn't mean to interrupt. So we have start strong, stutter detective, strategies, know what they are and what they're not. What's the 4th one? Lay it on us.
Support everyone's ability to connect with their own community and identity. So that includes us. We have to connect with each other to support our role, solidify our role, and support our changing roles in what we're doing in this neurodiversity affirming world. Scott and I laugh sometimes. It's like we've been talking about this for a long time, but somehow there's language surrounding it now, and everybody's like, okay, neurodiversity affirming. I understand that part. So let's pull that into what we're doing, but getting everyone connected. So ourselves, students who stutter, seeing other people who stutter. There's got lots of good access in stutter support groups. Ooh, I'll make sure I add that. I don't think I put the stutter support groups in the references, but I'll do that. We want them to have connection. The families. We could do a whole hour on collaborating and helping people around this child understand their roles and identities, because the kids come to therapy and get a lot of great stuff, but the siblings over here and the parents over there, and they don't understand the process of stuttering therapy, or how to be an effective, let's say, mom of a kid who stutters, or grandma of a kid who stutters. Those connections with the stuttering community are really important. They can listen to someone who's already walked the walk.
Yeah, I think those support groups are so wonderful. So yeah, thank you for going to share that with us. I think everyone would love to get into those. The one thing I know I need a little bit more is I need to know what are the strategies and what strategies are not strategies. I think that's an area for me that I'm definitely going to need to brush up on and be better. Yeah. So I think where are we at now? We're using that ICF. I think that's a game changer for everyone, because it basically, know your ICF, use it. That frames everything. I think I heard that right? I support that.
Totally, yes, you heard it right. It really is the beginning and the end of how we can make certain we are assessing and addressing all of the areas that a child may have impact as the speaker's experience.
Right. So that basically those key components of your comprehensive assessment are all those components in your ICF framework that we will have in the show notes, which will be available on the Speech Therapy PD website when you get that. And then when I think reframing our thoughts about student-centered goals, I think really what I heard is we're not focusing on fluency and reducing fluency. What are your strategies and resources for developing student-centered goals? The ICF framework.
Yes.
Right?
Yes, it
That's
is.
what
Yeah.
Mhm.
And of course there are, there's things in our book. We gave sample goals in our book. There's a handout for that. There's just a handout on framing goals on our website. We have handouts for parents, for SLPs, for teachers. There are free things on our website all over the place. And then there's some things that, of course, are 60 years of combined information in books.
If you don't mind, I wanted to go grab, there was a good question. I can't remember who asked it, but it was in response to if we are kind of, how do we, if we're being stuttering affirmative, verbal diversity affirmative, and that we are indicating that stuttering is actually just another way of speaking, how do we justify therapy to our administrators? I think that it was the question.
Oh, so easy. IDEA and a strong multi-dimensional assessment. It's okay to stutter doesn't mean go on and, live your life. Good luck. This kid is like, let's just say the kid is 9 years old, can't get 2 words out of their mouth. Are you really going to just let him go? Like that
No.
doesn't make any sense. Of course we have a role. Of course we have eligibility. IDEA, ICF, and a comprehensive assessment. Kids who stutter have impact. You've got to make sure you go look for it. I've had very few kids who stutter in my world, in my whole career, that didn't have any impact, negative impact on functional, social, or academic communication in their lives. As long as I did a great assessment, I found those areas that were problematic for them. Yeah, they might be talking in class, but I had a kiddo who didn't want to go out for varsity football. He was a star junior varsity player. He said, I can't go out for varsity because if the coach hears me stutter, he'll think I'm weak.
Oh,
Is he
wow.
eligible for public school therapy? You bet he is, because that's extracurricular functional communication, and he is holding himself back from something he wants because of his stutter. Absolutely. No. We're getting in there and we're going to make changes with that child for the better.
So something that we have to write in our IEPs is that impact statement.
Yes.
And I think right there, that is the justification for the therapy, that we're not saying that they're like you used defective. We're not saying, I love that, because that hits hard when you hear that. You're just like, oh, that's like a gasp. You're like, of course not. But that's kind of what they would hear if you're saying there's something wrong with you. And we're not saying that. We're saying you just speak a little differently. But there is an impact, and we're writing and explaining that impact, how it is impacting you going out for football or doing a oral report.
Yes.
Or actually saying more than just a 2-answer answer. You have so much more you want to express, because this is communication. Our focus on your ease of communication, not that you need to communicate better because you communicate wrong.
Right. And therein lies, you just wrapped it up, because here's the deal. It's so important. We are focused on communication. We are communication experts. And so when we focus on fluency, it's like, oh, it's okay to stutter. It's okay to stutter. Oh, wait, that one was a little bumpy. Can you make it smooth? Right now, I'm making a face for those of you on the podcast. I'm making a no face because that just sends the message. It's okay to a mixed message. It's okay to stutter, except for that one. You got to make that smooth. This we're confusing people in unnecessary ways. So this child is not broken. We do not need to fix them. But that doesn't mean the parents are going to be like, yay, that's great. Or the kid's going to be like, oh, you're not going to help me. They don't, no one's ever said, we're going to work on communication. No one, there are not very many kids who have heard an alternative to you've got to be fluent. You've got to stop, start over, take a deep breath, think about what you're going to say, just relax, slow down. There are too many of those things that are trying to fix the listener's experience. And what we want to do is validate that this is sometimes difficult for kids. It's not going to be just, oh, it's okay to stutter, honey, and they're going to believe it. They have to have guidance, long term, over time, understanding of what's happening and how they can navigate it. They don't have to control their speech for others. They can navigate their stutter in a world, and they can stutter like clean stutter, honest stutter, stutter like you mean it, kiddo. That is actually success. If they've been hiding their stutter, it's success if they start to stutter more. These are paradigm shifts that we're going to have to understand as a profession and then be able to language for others. And I think framing verbal diversity is very helpful in beginning that shift.
I think if we have one more question, what if a teacher or parent is concerned about their early elementary child who stutters, but there seems to be no negative impact at the time? I think you answered that, but that just came in, so maybe it wasn't clear.
Well, the first thing I would say is, what does seems to be no negative impact mean? Because
Mhm.
seems is not data driven. The kid talks in class, or you bring the kid in and they go, you ask them how they feel about their stutter, let's say, and they go, I'm fine. That's not data, right? There could be a million ways why that kid said, I'm fine. Maybe they are fine. Let's find out. Let's do the behavioral assessment battery. Let's do the Oasis if they're old enough. Let's do some looking behind the curtain of finding out what's underneath the surface. Use Sheehan's iceberg from 1970 to think about what you see on the surface is the tip of an iceberg. What the experience of stuttering is a lot of the things we can't see. So we have to dig deeper, and we have to make sure that there is no seems to. There is yes and no based on data.
I love it. I love it. Nina, you are amazing. I am going to beg you to come back. I already know I want us to do one specifically for those early childhood kiddos. That would be an amazing episode. So yes, I will get with you to see when you're available. So thank you for your time. Thank you for just everything that you've shared with us. Thank you for the resources that you're providing. And for go to her stuttering therapy resources.
Follow
Go.
us on social media because I'm always putting something fun up there.
Yes, you are. I love it. I love Nina's world. I love everything that you do. But it is time that we are going to have to come to an end. So, Nina, I'm already going to say we can't wait to have you back. Thank you so much.
And thanks everyone who joined us. I hope to be able to be with you again.
Yes, absolutely. Thank you so much. Bye-bye.
Bye-bye.